How are you today?
My name is Jean Putnam, and I'm the new System Chief Nurse Executive here at Baptist Health. My top priority is to provide a practice for nurses where this is the best place to practice their profession. I have patient experience under me, so we're creating a strategic plan for patient experience. We're patient-centered care. It's where patients belong, is in the middle of everything, right? And nurses are right there with them, in the middle of everything. Monthly, I go to every entity in terms of hospitals, and then I'm making my way through all the outpatient settings because there's a lot. But what I really like doing is putting on a pair of scrubs and following a nurse around who's actually at the bedside or in the clinic doing patient care. Every time I talk to first-line nurses, they tell me things to do it better and faster. So that's why I go out. And plus, I miss nursing and I miss patients. So I love going out and just rounding and seeing patients and families. Mentoring is something that is near and dear to my heart. I was the executive director of a local official Miss America preliminary program where I mentored young women in interview and self-improvement, how to be involved in their community. When I was in college, I had the opportunity to compete. I only did it one time, and I did it for the scholarship money. And I won my first local preliminary, and then I went to state, to Miss Indiana. I was first runner-up. I won enough money to pay for a large part of my graduate school and scholarship money, and that was really important to me, and I always wanted to give back. And I try to be a mentor to lots of people, probably too many sometimes, but I love that. It's so meaningful to me. So I've been married for 35 years. I was blessed with one child, a daughter. She lives in Chicago. She just had our very first grandbaby, a little boy, Jackson. And then I have a twin sister, and I have an older sister. And my mother has passed away, but my dad is still living. So family is #1 priority, and faith. If I wasn't doing this, I often joke I would be a female race car driver. Or, I know, but remember I grew up in Indiana, the Indianapolis 500, that was the thing. I wanted to be Danica Patrick before Danica Patrick was Danica Patrick. And I always wanted to do the weather. That was another thing, I would be a meteorologist. I just think it's such a privilege to be a nurse. There's just nothing else. We're the most trusted profession for 22 years in a row. And so it's special.